Hello, my name is LaNeshia Patrick. I am a psychiatric and mental health nurse practitioner and a adult gerontology nurse practitioner. And I currently work for a practice called Integrated Pain Solution that is located in North Carolina. We have many practices throughout the state of North Carolina. I currently work in Jacksonville, North Carolina. So I just wanted to just briefly speak to you all about PrognoCIS. I have been a nurse practitioner nearly 7 years with this company, and since I have started, I have always used PrognoCIS. Now, coming into this practice, I used several different EMR systems, and initially I was working in internal medicine using other EMRs that was a little bit more difficult to navigate through. So one of the things that I appreciated the most, especially transitioning from intern medicine to pain management and then later on to psych, is that it was a very easy transition with using this particular EMR. It's very easy to navigate through. I love certain features about this particular EMR. One of my favorite is the face sheet. The face sheet has all the information, of course, that we document, the patient history, family history, medication. But I also like all the different alerts that they have. They have alerts that could be added to the charts, and they also have alerts that are notes, sticky notes for us, so that as a provider, we can take mental notes and we can have notes that reminds us of different things, even if it's as simple as a nickname that the patient prefer to be called. So we can make the transition of care from each appointment to the next appointment very easy, and it helps us to remember and guide us as we're taking care of our patient. Another feature that I love about PrognoCIS is the prescription feature. I love it because it has so many safety checks. Once we prescribe the medication, especially dealing with some of the medication that we deal with in pain management and also some of the medications that I deal with in psych, they have many safety checks, many different information to make sure we're checking the side effects. We have to acknowledge that we read it. And I also like the fact that the PMP, which is the query, is also embedded in the EMR. So therefore, I do not have to log into another system to check the PMP before I prescribe a narcotic or a controlled substance. Everything is already in PrognoCIS. So that makes it very, very simple for me as a provider. And that way I don't have to have so many screens open at one time. So that's one of my favorite features, especially since I use that feature a lot. And so like I said, PrognoCIS overall is very, very simple to use. I believe it doesn't matter what age the provider is. It's something that's easy to navigate through. As I mentioned in the beginning, I've used several, and I do mean several different EMRs working at different places. And this by far has been one of the easiest ones to use. And another thing I would like to add is that not only do I use PrognoCIS for the pain management side, I also use PrognoCIS for the psychiatric side. And just as on the pain management side, the psychiatric side is also very easy to use. And I love the fact that there are many tests on some of the psychological evaluations are already embedded in PrognoCIS. So instead of me having to go and pull these things, like if I need to test someone for depression or if I'm testing a patient for ADHD, those particular tests that I need are already in PrognoCIS. So I can go click on the test that I need. It will pull up all the questions that I need to ask, and it will also add it up. So it just makes it very simple for me as a provider as I navigate through my busy day. So like I said, been using this system for nearly 7 years, and I have no complaints about the system. And I also just want to mention that the support staff as well. Anytime we use electronics, we know that there will be times when things go down. I mean, it's inevitable, right? And we know that we are in a computer and a technology world. But one thing I love is that the support staff is really hands-on. It is very easy to get in touch with them, and they also keep us updated. If something is going on and it's an extended time, they're going to email us. They're going to let us know that they're working out the kinks. They're going to let us know where we are as far as how long it may be. So I can appreciate that as a provider, to know and be updated and not have to go back and continue to check and see what's going on. So that is another thing that I love about PrognoCIS, not just the EMR, but the support that as a provider that we receive. And luckily, we do not have to use that support very often. But when we do, I do appreciate that they are right there. They are right there with us, figuring out and making sure they're keeping us informed. So those are just a few things that I have learned and has helped me with this EMR. I hope this helps you as well. Have a great day.